Hello friends, today we are going to discuss about Obsessive Compulsive Personality Disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about Obsessive Compulsive Personality Disorder, diagnosis, prevalence, and management. What is this Obsessive Compulsive Personality Disorder? As per the DSM-5 diagnosis, they should have a pervasive pattern of preoccupation with orderliness, perfectionism, and mental and interpersonal control at the expense of flexibility, openness, and efficiency. And they should be present in various contexts. Let's look into them. They need to have at least 4 or more symptoms to diagnose obsessive compulsive personality disorder. First one is they are preoccupied with details, rules, list, order, organization, or schedules to the extent the major point of the activity is lost. They show perfectionism that interferes with their task of completion. They are excessively devoted to work and productivity to the exclusion of their leisure activities and friendships. They are overconsciousness, scrupulous, and inflexible about the matter of morality, ethics, and values. They are unable to discard worn out things which are worthless objects when they have no sentimental value also. They are reluctant to delegate the task to any other person or work because they feel they need to be done in a particular way. They will only delegate to those people whom they have confidence that they will deliver the work in the same quality as they want. Adapts to misery, spending style towards both self and others. Money is viewed as something to be hoarded for future catastrophe. Shows rigidity and stubbornness. These are the OCPD diagnostic criteria. Let's look into the prevalence. The prevalence of OCPD is somewhere around 2 to 8%, my dear friends. Here in OCPD, comorbidity is the rule. The comorbid conditions which exist with OCPD are depression, bipolar affective disorder, anxiety disorder such as social phobia, panic disorder, agoraphobia, generalized anxiety disorder, eating disorder, substance use disorder, and somatization disorder. Let's look into the management. In the management, one need to differentiate between OCD and OCPD. In OCPD, their onset is from the adolescence. They are preoccupied with the details, rules, list, order, organization, and schedules. They invariably will successful in their work, but they will not be able to enjoy the work. They will be focused on their list, details, perfectionism. They do not avoid the work. Whereas in OCD, they will have repeated thoughts, repeated acts. When they know they are ego dystonic, they do not want these thoughts and acts, but they are unable to stop them. They start avoiding things. That is OCD, my dear friends. Challenges in diagnosis of OCPD. Whenever OCD and OCPD are comorbidly present, it's very difficult to tease out between OCD and OCPD. The presence of OCPD in OCD causes poor outcome. OCPD with other personality disorder like ASPD, AAPD, and borderline personality disorder are again very difficult to treat. Diagnosis of OCPD can be done by a good clinician by good history taking, detailed evaluation, and clinical interview. There are various other instruments such as SPI, SCID-5, MMPI-2, MCMI-3, and PDQ-4 can be used. Further, obsessive compulsive personality inventory can also be used for the diagnosis of OCPD. Similar to any other treatment of any PDs, the treatment of OCPD is by psychotherapy, medication, and combination of both. However, there are only few studies with regard to treatment of OCPD. Hence, we cannot give a evidence-based treatment recommendation for OCPD. However, the available literature says that the psychotherapy is the first line of treatment in OCPD, such as CBT, exposure and response prevention, mindfulness, group therapy can be tried in OCPD. Medications such as SSRI, tricyclic antidepressants like clomipramine can be tried in the treatment of OCPD. To conclude, my dear friend, OCPD is one of the commonest personality disorder. OCPD or preoccupation with rules, regulation, ethics, moral, and standard is the hallmark of Diagnosis of OCPD. Available evidence indicate that CBT and ERP is the first line of treatment in OCPD. SSRIs can be considered in the treatment of OCPD, my dear friends. Thank you very much for giving your valuable time. Stay safe.